Okay, doke.
Christy Collins is our patient navigator, and she's not here today, so I have a business card for you. She does all the clearances, setting it up for you. You can call her if you have any insurance questions or about your clearance. Just give her some time to make those appointments, okay? Do you have a My Chart activated in the system? Patient portal?
Yes.
Okay. Then if you can see your appointment scheduled there, she might call you too about them, okay? Then I have a checklist for you. I'm going to make you copies when we're all done here. It looks like this, okay? And as she schedules you your cardiology appointment and pulmonary and all that, you can put the date that you went once they're cleared. And today I'm going to sit you down for labs and a chest X-ray. Labs are on the first floor, and I have a paper for you. Chest X-rays on the second. I'll put your orders in when we're done. It tells you here where they're at, okay? And then, did you bring in your back height, weight, and BMI over the last 5 years? We can use today's date for 2000. Okay, just contact your primary care. Do you think you've been seen once a year?
No, I haven't seen him for like 4 or 5 years.
Okay, because you won't qualify for surgery then based on your insurance. If you can't get that, you'd have to switch over. Can you switch your insurance to Unicare or Aetna Better Health?
I don't know how to go about doing that.
You'd have to contact your health insurance to see if you qualify, or you can switch over to the other Medicare plans. That would be the only way that you'd qualify. Because if you don't have a back height, weight, and BMI like we discussed at info session, we gave you those packets. They want you to give us a back height, weight, and BMI for the last 5 years, 1 month out of each year. So if you don't have that, you don't qualify right now. So there's no sense in going forward through the appointment. We discussed that at the info session and gave you that in the packets. So you definitely weren't seen by anyone, not even emergency room or anything?
Maybe emergency room. I didn't go to my primary care physician for 2 years.
So the only other thing you could do is switch your insurance company, which people usually can do. I don't know if you can or not, like depending on what other health needs that you have. Sometimes you can call and switch over to Aetna Better Health, it's called. If you want to write this down, you can write it on your pager there. You don't have to turn that in. Unicare or Aetna Better Health. And usually they can switch it over and it's effective the next month.
Okay.
Unicare, UNICARE, or Aetna Better Health. AETNA, I think. ETNA.
Okay.
Better Health. So you have to call the back, like your insurance card, and see if you can switch over to one of those two. And they don't require you to get that for me. And then like right now, you'd be 12 months in the program and have to lose 10% of your body weight. That one is 7 months and the other is 6 months, and you don't have to get me that, and then you would qualify. So do you think you want to do that?
Yeah, I could probably try switching over.
Okay. And usually when you switch over, it's effective the first of the month. And then if you do that, just call us back and give the girls, there are phone numbers on there, give them your new insurance information.
Okay.
You want to just do that? We'll just move forward with today then?
Yeah.
Okay. I'll just give me my pen back and I'll tell them.
Sorry,
Okay, so we'll do that. But for now, we're just going to pretend like you're going to keep this insurance. You have to lose 10%, which is 36 pounds. Your goal weight's 324. You'll be in the program for 12 months, but you're not going to qualify if you don't have that, so it's no sense. You know what I mean? So if this doesn't work out for you, call us and let us know, and then we'll have to see. If you don't, then you won't be able to move forward, okay? So I'm going to ask you a few questions about your history. Are you most interested in the sleeve gastrectomy since the info session? The sleeve?
Yeah.
Have you ever, you used tobacco and quit in 2015. Do you vape or anything now?
No.
So, okay. How many years did you use tobacco for?
Not even a year.
Okay. Alcohol, yes. Monthly or less 1 to 2 drinks. Do you still do monthly or less?
No.
Less than monthly. How about drugs? I see on here marijuana.
No, I haven't done
quit?
marijuana since
2015?
Yeah.
How often did you use marijuana? How many years?
Not even a year.
Less than.
When I found out I was pregnant with my daughter, I quit everything bad.
Okay, good. How about aspirin, Aleve, ibuprofen, Motrin, Celebrex, and Naproxen?
Not Celebrex, but I've taken the other meds.
Yeah, ibuprofen?
Yeah.
Okay. How often do you take that?
When I have bad migraines or hip pain.
How often in a month? Would you say?
Probably about 1 day a week.
Okay. All right. Thank you for that. Okay. So sleeve. Okay. So here, this is a number. We need a letter of medical necessity from your primary care physician. This is a template I want them to use. Put in your information why they feel they get benefit from bariatric surgery along with a bolded statement. And then have them fax it back to that number. We'll stick it in your chart and we'll do the authorization for you when it's closer to surgery, okay? This here is Christy's number again. She's the one who will establish all your clearances, like I said. Just give her time to do that. If you call and cancel clearances, it will probably postpone your surgery date. This year is the diet classes. It has to be consecutive. You can't miss a month. If you miss a month, you have to restart the program. Okay, that's an insurance requirement. Down here, authorization can take 1 to 6 weeks, and we'll do that for you.
Okay.
Right now, because you have Medicaid, I do have to have you sign this waiver.
Do Aetna and Unicare, they provide pretty much the same thing as Medicaid?
I think, I'm not really sure of that answer. It depends on what you need it for. Like if you have, I see mental health on here. I don't know if you go to therapy or anything, do you?
I have a therapist with Valley.
You need to ask them about things like that, if they cover the same things for therapy. And whatever you do now that is important to you, just ask if it's in that plan. So that's the most important thing, okay? I really don't know the differences. I do know that they cover bariatrics though. But that's the most important thing, is to make sure that the things that you utilize for other health reasons, make sure that they cover those, okay? Because then there's no sense in switching if you need those things, you know what I mean? Right. Okay. All right. This here, and then, I mean, we need it for just this type of Medicaid, but it's just saying that you have to come to all your follow-up appointments, and they don't cover skin removal, plastic surgery, and that's all that's saying. Have you sign there? Thank you.
That would drive me crazy, slanted paper.
It keeps coming out. It just broke. Alright, next. You have to be tobacco free, including cigarettes, e-cigarettes, vaping, marijuana, and medical marijuana for 3 months and for life thereafter. The reason is, even marijuana, because it can cause life-threatening complications called marginal ulcers. A lot of pain, bleeding, and time to heal. Over 6 months on 3 different medications, and oftentimes patients are hospitalized, so it's very important you don't restart that.
Yeah.
Okay? And then WV does have the right to randomly drug test or tobacco test anyone in the program at any time. Failure to comply can mean delay or cancellation of the surgery, okay? You have to be alcohol-free 3 months prior and 6 months after. We need time for the staple line to heal. Have you sign here and here? Do you take oral steroids like prednisone? Much.
Have I?
Have you lately or in the past you?
No, I don't think so.
That's something you need to tell us if you do, because once you get an OR date, you can't take that right before surgery or after.
Okay.
We have to postpone your
Normally the only
surgery.
reason I would take prednisone is for UTI.
Okay.
I haven't had one in a while.
Okay. Just let us know if we give you a surgery date that if you have to be on that, we have to just postpone your surgery.
Okay.
Because it can cause a leak.
You're down here too?
Yes, ma'am.
What about secondhand smoke?
Well, secondhand smoke, that would be okay for sleeve. Is it in the house with you?
My employer, the client that I take care of, she smokes.
Okay. Sleeve would be better, is a better fit for you, so that'll be okay. Should be okay. Just don't,
I mean, I can ask her, but...
No, it'll be okay. The sleeve, I mean, that is the best fit for you. So a bypass, I mean, if you're around it all the time, that might be dangerous, but you should be Okay, not only for our department, but all the specialties you're going to come in contact with. The first no-show, a letter to be sent out of courtesy reminding you of our policy. Second no-show, progression through our program will be suspended for 3 months. And a third no-show be suspended for a year. The team can decide to remove a patient from the program. Down here, if you're 15 minutes past your scheduled appointment time, we ask the patient to go home and reschedule. Okay? Have you sign here? Do you work for a group home?
I'm an in-home care aide.
Oh, okay, nice. I used to do that. I used to like doing that, but for the elderly. And then I had a quadriplegic when I was in college. It's a nice, rewarding job. Do you like your client? Yes, not.
I can't really talk about it.
Yeah.
HIPAA and all that.
Yeah. Well, I don't want to know a name, but sometimes you have good clients and bad clients. Okay, so if the risk of surgery does not weigh the benefit or it's too great, your safety would come first. Okay. Down here, psychological problems that can be identified during their visit as long as the patient's stable, their moods are stable, they're on medication, usually not a problem. Some people do need more than one visit before moving forward with this type of surgery. If someone has an active eating disorder or binge eating, that is something that needs to be resolved so that everyone has successful outcomes we want. And we have classes for those disorders, okay? Tobacco and alcohol-free policy I went over. Nutritional program, they're going to come in today, Rachel, and talk to you about her program. No shows I went over, and unprofessional behavior. If any patient is disrespectful, demeaning, or disruptive to any healthcare provider, it is grounds for delay or dismissal in our program.
Would it be a good idea to say put locks on the refrigerator and the pantry and give the key to my husband?
For you?
Yeah, because I'll be sitting there home and I'm so bored and I'm like, let's go see if there's something I can do in the kitchen.
Well, I mean, you have to gain better control, I think.
I mean, it's not like I'm not a junk food person.
Are you a binge eater, do you think?
I don't do candy or sweets or anything like that, but I like the savory side of food.
Yeah. Well, talk to the dietitian about that. Do you feel that you binge eat sometimes or emotional eat? Because we have classes for that might help you.
Yeah.
Sometimes emotional will. Yeah, well, just be honest whenever you go to the therapy session and with Rachel. Tell her that, okay? She's going to be the one going over your nutritional packet. She's going to go over that with you and your recall and stuff, okay? So just tell her that. Any questions? Maybe she can give you an idea for the savory part. I mean, she knows more about that. Like,
I heard that if you paint your kitchen blue, it helps with cravings.
I don't know.
I heard that some years ago when I was watching the DIY channel.
That's neat. Maybe it makes sense.
Different colors make you.
That's interesting. I'll have to look that up.
Mess with your head.
I'm not sure. Okay, any questions? No. All right, I'm going to go give you copies, okay? Just make sure you look into that insurance thing. That's really important because I'm going to let you continue through today, okay?
Thank you.
You're welcome.
Okay, so that was strange and a wee bit loud, but we got through it. And I have to go change my insurance because I really, really, really want this surgery. A lot of things to change, though. Diet, exercise, activity level. Stress level, definitely stress level. But we'll get through it together.